Welcome to Boobs Aren't Worth Dying For, the podcast dedicated to integrative health and healing from breast cancer and breast cancer treatment using the best of conventional and natural medicine. Your host, Deborah Beaumont, is an advanced practice nurse, functional medicine practitioner, and fellow breast cancer survivor.
Thank you for joining me for today's episode of Boobs Aren't Worth Dying For. I'm your host, Deborah Beaumont. I'm glad that you're joining me today. In today's episode, we're going to be talking to a young woman. I have found her blogging to be so interesting and so helpful because, for one thing, it's a very creative and expressive way to deal with some of the emotional stuff that comes up. But she really brings to light some very important issues that I think we all need to know about. All too often, if we're struggling with anxiety, depression, or even post-traumatic stress, we're told to take a pill, take a prescription, maybe see a therapist. But that's not really the answer in many cases, and it's not everything that's going to help us deal with these complex feelings that come up, not only at diagnosis, but through treatment and sometimes afterwards. And today's guest really talks about that. I'd like to take a minute to introduce Maegan Mohlner is a social worker in Waco, Texas. She lives there with her husband, Nick, and her dog, Wedge, who she just told me is quite a large dog. I think he's 110 pounds, so he really is a wedge. Maegan previously worked with oncology patients in the hospital setting before she herself was diagnosed with breast cancer. And that happened just 3 weeks before her wedding. So you can imagine what a shock that was in her life. She had an aggressive form of breast cancer. And at the age of 26, she had to deal with this with everything else that was going on in her life. That's one of the things that I think she talks about very eloquently, what it was like to be diagnosed at such a young age, because all too often the attitude is that breast cancer is something that affects women that are older, and it's actually increasingly affecting younger and younger women. Maegan has a passion for education and advocacy around that, and actually teaching young women, teaching young men about warning signs, detection, things that we need to do. And she really highlights that in her blog very nicely. She uses humor and vulnerability to spread her message. Her blog is netflixandchemo.com. I am thrilled that she is here to talk with us today. Thank you for joining us, Maegan.
Yes, thank you so much for having me. I'm so excited.
Well, just in your intro that we went through, I think you've already addressed some of the 2 or 3 major myths that I talk to people about. And one of those myths, I think, that really trips people up is that they think that breast cancer just affects older women in menopause. And I have experienced and found that younger and younger women, unfortunately, are being diagnosed, unfortunately, even as young as you in your 20s. So I'm wondering if you could tell us a little bit about that.
Yes, of course. As I have found just in different support groups, online Facebook groups, the number of young women diagnosed with breast cancer is growing astronomically. I myself was diagnosed with triple negative breast cancer. It is negative for any kind of hormone receptors. And this type, it's a little more rare, but it's showing up in younger women more and more. Now, I have no breast cancer history in my family. I do not carry the BRCA gene, so it really came out of nowhere. It's just been very interesting kind of navigating how this works. Like you said, a lot of women who are diagnosed are either going through menopause or postmenopausal. I was 26, chemo put me into menopause, and then fortunately I came out of it after treatment. But a lot of unexpected things, a lot of things regarding fertility that aren't talked about with doctors. And so there's a lot of area for advocacy and education for patients as well as doctors who are going to start seeing younger and younger women.
Right. Yeah. Myself personally, when I went through my diagnosis and treatment, I was part of a community in the Bay Area that does a fundraiser once a year, and it's a really amazing organization. I was really surprised. There were, I believe, between 35 and 40 models. It was a fashion show. At least a third were women in their early 40s. Many of them were in their 30s, and one woman was 28. And so this myth that breast cancer is just something that you deal with when you get older really needs to be called out and put into the light, because I think it really affects whether women are getting proper assessment, proper screening, and if they're even thinking about it. Fortunately, even some of the medical stuff, like recommendations about how often or when you should start mammograms, they're pushing the age back and not even starting the screening until older and older. So I think this is a really important thing for women to know, that you need to be really aware of the fact that it's affecting younger and younger women.
Oh, I completely agree. I mean, that awareness that it can happen, and then there's not a lot of education. I mean, I have to say, at 26, had never had somebody sit down and show me or tell me how to do a self exam, because it's not something that your gynecologist is talking to you about yet when you're in your early 20s. And so, right now, tomorrow morning, I'm going to Baylor University, and I like to talk to young women. That college age is perfect, and just let them know it can happen to you if you don't have a family history, if you don't have a gene. I mean, those things should always kind of give you red flags and up your awareness even more, but it can happen to anyone. And so it's important knowing how to perform self-exams. And then another really important part of that is being an advocate for yourself. I know it can be scary, speaking with doctors, they kind of have the power in that room, but kind of taking back some of that power and knowing that you are the expert of your own body. I mean, I know when I felt something, I felt like I was kind of blown off by the first doctor. So they sent me to get an ultrasound the next week. And when I went in, the tech was very sweet, but she kept telling me, no, you don't have a history and this is fine. You're too young. It's definitely not cancer. It's definitely not cancer. And then before I left, she gave me a hug and said, don't lose any sleep over this. And then I found out that next week that it was cancer. And so while I know she was trying to be kind and everything, I mean, you really have to advocate for yourself and know that it can happen to you. And that if doctors aren't used to seeing that, or technicians aren't used to seeing that, they're just not going to be, I think, usually as vigilant as they would with an older woman.
Right. And I believe that there are so many myths about breast cancer screening, that, and unfortunately, doctors are trained in a way that they're kind of perpetuating the myth. One of our episodes that I did earlier was with an expert, a woman who unfortunately found out that she had advanced stage breast cancer after she had been religious about her screenings for many years, but had never been told she has dense breast. And breast density is not only a breast cancer risk, but it's also a reason that a mammogram has a very strong likelihood of not even picking up the breast cancer. But she didn't know that, so she didn't know to ask the question, and she was diagnosed at a later stage. So there are just so many myths that we need to be talking about, and unfortunately, we end up talking about them when we've gone through it ourselves, and we've kind of fallen through the cracks.
Mm-hmm. No, I completely agree. And I really, this is for another time, but, I know that they're trying to push back mammograms and everything. And I know that when I had my ultrasound, the tumor was right there, big as can be. And then they did a mammogram on me, and you could barely make it out. If you weren't looking for it, you couldn't see it. And so I really wish there was more advocacy around getting breast ultrasounds becoming the norm for people who are at higher risk. I just feel like they have more accuracy. And I know that if I had just gotten a mammogram and not an ultrasound, I don't know that they would have found it.
I absolutely agree with you. And, as I said, there are, I want to change the language. Actually, I want the language. And this is a real problem with doctors. They'll say, have you had your yearly mammogram? We need to even change the language to your yearly breast exam. Your breast exam is going to include other modalities if a mammogram is not the ideal screening test for you. That includes breast self-exam. It includes ultrasound, even 3D mammograms. But we need to really change the language and the thinking, so we're thinking about overall breast health and not just trying to diagnose a tumor or a disease, because none of the screening methods that we have is that reliable to do that on a consistent basis, so that when you leave that exam room, you can have that peace of mind of knowing, wow, I'm 100% clear here. Nothing we have out there in the medical or the alternative world answers that question. And we need to know that, because like you said, it's our own knowledge and our own ability to know our bodies that's going to make the difference. Like you, I actually felt a lump in my breast. I was at Disneyland, as a matter of fact, the happiest place on earth on a Saturday night, and I felt the lump. And I knew instantly, and yet when I went in on Monday, to see my doctor, she said, "Oh, I don't feel anything. I think you just have, really cystic breasts. Don't worry about it. It's no big deal." And it was like, "No, I'm worried about it and you need to do something." And then, of course, had the mammogram and the ultrasound. But the fact is that just because a doctor tells you, "Don't worry about this," that's not the end of the story. And we all need to be empowered to say, "No, I need to have this examined more thoroughly," because a lot of it is missed.
Oh, I completely. And it's so funny you said that you had a feeling because, it sounds crazy, but the moment I felt it, I knew. And,
Right.
Even when the woman was telling me, "Oh, you're too young. Oh, it's nothing." And even though I didn't have a history, it didn't make me feel better when she was saying that because I just had this pit in my stomach and I knew what it was. And it's just crazy how we we truly are the only experts of our own bodies. And I knew something was wrong. I knew it.
Also, certain leading cancer organizations are actually telling women to not do self-breast exam because it's not reliable and consistent and blah, 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 blah. So that's not even being encouraged. I don't quote me on this, but I think I heard an interview where somebody said they had gone through the Komen Foundation and they're not even recommending doing breast self-exam routinely on yourself. And to me, that's crazy. I mean, that's the first place that it should start, and more often that's where we're going to catch it before you ever go get any kind of testing done.
Oh, exactly. And I cannot imagine. And I hope that there is not a doctor out there that would say, or I hope there's a doctor that would say, I would rather see 20 patients who felt something and it turned out to be nothing than one patient who didn't feel themselves ever and this lump continued to grow and continued to spread. I mean, that's just so crazy to me because, that self-exam that I performed. I was laying in bed. I don't know what I was doing. It was the first self-exam I had ever done. I mean, I think it was one of those, I had a weird feeling. The first exam I'd ever done. And I wasn't even doing it right. Luckily, mine was very large. It was towards the top of my chest, almost on my flat area. And so I thought, it was attached to my chest wall, not actually in my breast. And so, I luckily was able to feel it and make out the edges very, very clearly. If it had been deeper or in a different place and harder to get to, I don't know that I would have ever felt it. And then I'm not sure if you're familiar with, I believe it's an organization now, Know Your Lemons.
Yeah. I love them.
Yeah. And I mean, I think that that's absolutely fabulous too. I think that poster, so for those that don't know, it's a bunch of lemons and each one has a different kind of symptom of breast cancer. There's the dimpling, the enlarged, the redness, the lump, kind of that's one of the more obvious ones to feel. But these symptoms, that needs to be in every OBGYN office, every PCP office. It blows my mind that we are not trying to make every single woman aware of these signs.
Yeah, so just as a little side note, this is called knowyourlemons.com, and it's they have all sorts of educational material. But the thing that they really bring to light is that it's not just one symptom. As a matter of fact, the most common form of breast cancer is ductal carcinoma, but there are other forms of breast cancer. One of them is called inflammatory breast cancer that is actually defined by a diffuse swelling, and you might see color changes or size changes or temperature changes, but it's more diffuse and in the tissue, so you may not feel a lump, but it's still an aggressive form of breast cancer. So yeah, that's a really great resource, and I'll list that in our show notes because that's a really great resource for women, and it's a nice, not fun way, but less threatening way to think about it and to look at it, than
definitely
looking at ultrasound studies and whatever. But that's a really great resource. I was introduced to you by reading one of the writings that I think was in your blog, and I know that you really focus on the emotional coping that women go through, particularly after treatment is over. So I'm wondering if you could talk about that a little bit, because I, like you, feel that's such an under-addressed issue that we all have to think about and be aware of, how to deal emotionally with the journey and that period of what happens once you ring the chemo bell or chemo's over. I think women think, oh, my journey's over. And in some ways it's just beginning. That's
definitely. So I believe there's a big misconception that when you are diagnosed with cancer, that is when it all hits you, and that is when there is a rush of emotion. And I will say that, at least in my experience and a lot of those that I've spoken to about this, the original getting diagnosed is very traumatic. But after diagnosis, I mean, I was diagnosed about 3 weeks before the wedding. And before the wedding, I had already had one chemo treatment, and I had a plan for surgery, and I'd met with the surgeon. And that surgery wasn't going to be until about 8 or 9 months later. I mean, once I was diagnosed, we hit the ground running, and I was meeting with people every single day for the first week and a half to start that chemo. And so there's just so much, it's such a whirlwind that it really, it was sad and it was scary, but I almost didn't have time to process all of it.
Right.
Now, I did have a couple professionals tell me, you should really seek counseling, seek support, particularly for young women. I wasn't really able to find a lot of support in my area. I had treatment in a larger city in Austin, but I live about an hour and a half away in Waco, and there wasn't a lot here particularly for younger women. So there was a lot of questions. I was doing a lot of research on my own, and I found that through blogging, I was really able to process what I needed to process at that time. Now, when things got really hard for me, and when they get hard for a lot of women, is when the dust kind of settles and everything has slowed down, and you're told, okay, you're done with treatment, you're done with surgery, go back to living a normal life.
Right. Whatever that is.
Exactly. And everyone, it's a new normal. Well, it's different, and it's hard. It is very hard. And after that, women aren't told you should seek help after all of this has happened. I kept seeing women in these groups on Facebook saying things like, I'm done with treatment, but there are days I can't get out of bed. I am not sleeping. I have so much anxiety. I don't know what this is. And a lot of people, are responding and saying, oh, we all have bad days, or there's this or this, that. And there's not enough people saying now is when you need to speak with someone. If it's affecting your daily life and you're not getting out of bed and you're calling in sick, which are a lot of the things that I started to do, it's time to get help. And so I noticed that I was lacking a feeling of purpose. I thought, okay, I did all of this. Now what? What is left for me? What is, this is it's difficult. I don't know where to go from here. So there was times I kind of started pulling myself up in the house. I was very irritable. You're at that very awkward stage where your hair is just starting to grow back, and it's hard to manage. And what does this look like? Do I go to work like this? And it got to the point where I was just having just really terrible thoughts. And it's always hard to say out loud, but there would be times where it would be like, I almost wish that I hadn't survived. And it sounds so callous, especially to people who have not gone through it, especially to your loved ones who say, how could you say that? But thinking that, number one, thinking that is okay if we're not, acting upon it. But that's when we know, okay, I need to seek some help. My husband is also has his master's in social work, which I'm very fortunate to have had someone like that next to me this whole time. But he really urged me, I think it's time that you talk to somebody. And after my, however many days in bed, I did seek professional help. I walked into that office and we spoke, and it did not take her very long to say, you have PTSD. And immediately when she said that, it all fell into place and it all clicked. Because when we think of PTSD as a majority, we are thinking people who have gone into battle, people who have been, shipped off to war, people who have experienced or been witnesses to violent acts. And really, we have been witnesses to that. We have gone to war in a sense. And so you're really just facing the repercussions of everything that you've gone through. And it explained my lack of sleep. It explained the depression, the anxiety. I mean, my husband, little things that don't really make sense. Before my husband would walk into a room, he would kind of have to announce himself because I became so jumpy. Right. Everything scared me. I was on edge constantly. And that is not a way to live when you're constantly just so anxious. And so, that's when I was diagnosed. And that's when things really giving it a name was helpful. and having a plan was helpful. And that's when things started to change for me.
I too went through this, and I did one of my prior episodes on post-traumatic stress, because I do really think we have to rethink this. And a couple things I wanted to highlight. You mentioned, and I absolutely agree, that people associate PTSD with going into battle. But think about the language that we and society use when someone's going through breast cancer. Oh, she's a breast cancer warrior. Oh, she's fighting cancer. She's fighting the good fight, the battle. We have gone through a personal battle. Unfortunately, it's not one that's understood very well, usually by people who haven't been there. And one of the other things that really occurred to me when you were talking is that not only do you, as the patient going through this, I hate that word, but client, patient going through this, have an expectation that it's going to be over when treatment is done, but people around you do. It is not infrequent that I hear from my clients, well, my husband said, I saw you through this, and now just get over it and get back to yourself. And that not only is not helpful, it is literally impossible. If you are going through post-traumatic stress, depression, and anxiety, we live in a society that doesn't have a lot of understanding for psychological issues and for people who are struggling with depression and anxiety. But if you're going through that, you literally cannot pull yourself up by your own bootstraps and just be different because somebody tells you to be different. And yet there's that expectation from friends and family that puts more guilt and more pressure on you, and often just leaves you feeling more isolated and alone and in that spiral of anxiety and depression.
Oh, exactly. I completely agree with all of that. And to touch once more just on the battle, language that's used, I think a lot of people, they want to compare. They want to say, okay, well, you weren't being shot at or and the thing is, it's all hard. Right. It's all difficult. And it can all be PTSD. We're not saying that one thing is worse than the other because it's all terrible. And I think it's when people want to try to compare in a way of, well, who has it worse kind of thing. That's not a competition. But people get very defensive about that PTSD language. But it's really other people around you. And like you said, other people urging you to get better faster or to be okay or to get over it. This is not just a mental thing. This is an emotional thing. This is a physical thing. Your body is still bouncing back.
For me as a functional medicine practitioner, the first thing that, I really want to look at is, you don't have to have a science degree to really give credit to the tremendous onslaught that your body has gone through by all these treatments. So in addition to all this, you're dealing with hormonal imbalances, you're dealing with chemical changes, you're dealing with being on drugs. It's very common to have to take drugs that radically put you into menopause, and cause extreme hormonal shifts. So it's not even a matter of a psychological experience. Many times it's a physical one as well. So much is focused on what is the next surgery or what is the next chemo drug that I just think there's not enough attention paid to what happens, like you said, when the dust settles and you're kind of like left in this different place than where you started and you didn't plan on being.
Exactly. And I know for younger women as well, there's a lot of grief. So I think it's also to note that for younger women who are still of childbearing age, especially for the ones who haven't had children yet, a lot of the time they're losing, especially if they're BRCA positive and they need to go ahead and have a radical hysterectomy. That's taking away their ability to carry a child. But you also, I personally don't have children, and I had to grieve the fact that I'll never be able to breastfeed my child. And for other people, it's the fact that they will go into menopause and they don't come out of it like some other people do. Or the fact that you might have mental fog forever, or the fact that your body is going to be different. Every time you pass a mirror, you're going to look different, whether it's your hair or your scars or your shape. And so I think that along with the PTSD, there's also a lot of grieving. And everyone says, grieving takes time. Time is what's going to heal these things. So when you have people saying, okay, come on, get over it. We've already moved on. Why haven't you caught up? I think people forget about, so there's so much loss in cancer.
Right. And, you brought up something that for me personally was just kind of eye-opening, but you mentioned the loss of a sense of purpose. And boy, that just really brought me back personally. And I think I've told this story before, but I had breast cancer, but 10 years prior to that, I had cervical cancer. And I ended up having a radical hysterectomy. And I've told the story of complications, but the biggest thing that went on for me for several years is I was 39 at the time and went through a radical hysterectomy, and I was single, had not had children. But I had never stopped and taken time out of my career to realize that I always expected to have children. And then all of a sudden that was taken from me. And I went through a period of several years that it wasn't always depression, but it was that it just felt like a hole. It just felt like something was missing, that sense of purpose, and I realized that, that had been my story. My whole life, was always that we were going to have children, and I didn't, and that loss of purpose was really the most difficult thing to deal with. I'm so glad that you mentioned that, because this is in so many ways a life-changing experience. It's not just the diagnosis, but it changes how you relate to your family. It may change your career. In my case, it took me out of the main thrust of my career and became something completely different that I didn't anticipate. And I didn't want that. I didn't ask for that. And I lost a lot of time trying to make sense of that. And then it's also really hard to explain to people, like I was a transport nurse. So I was, at a good point in my career. And I look at friends now who didn't have years of their lives just taken out by cancer, who are at a point in their life that I thought I would be at, and I'm not. And that's a whole adjustment process to kind of reorder who you are in relation to your career, your family, your body. That's a huge process that is not going to happen in a short period of time. I'm so glad that you were really highlighted that, because that really personally brought me back to something that I sometimes forget about. And it's actually very...
Mm-hmm. Oh, definitely. Yes. I think that purpose, whether it be, exactly like you stated, a career, a lot of people change careers after a diagnosis like cancer, whether it's a career, relationships, friendship, having children, whether or not you're going to have children, a lot of that changes. And it's something you don't anticipate. I loved how you said it's not something that you asked for, but this is something that was kind of dropped in your lap. And then it's also somehow your responsibility to navigate how to get out of that. And,
right.
Just completely unfair.
Right. That's it. It's unfair. And, and anybody in this place has a right to just, it's not wallowing or self-pity. It's unfair, and you have a right to experience that. It's just not fair. I look at many women that I worked with, and I look at where their lives are, and they're having kids, and, and I'm happy for them. It's not that I begrudge them that, but it never comes without that bittersweet experience that wasn't a choice that was given to me. And I think that it's important to acknowledge that in terms of the whole healing process. You don't always have to be cheerful or make this okay for people or make people understand it. You can't. Sometimes you can barely understand it yourself. I think that it's just honoring the right that you have the right to sometimes just feel like this was unfair and I didn't deserve this. And we don't live in a world that allows you to do that, because that's feeling sorry for yourself, or that's pitying yourself. That's just the reality. Mm-hmm. And
completely.
I really want to talk about, you said that blogging became an outlet for you, which I think is wonderful, because one of the things that I think can be very healing is to find creative outlets. For me, it's this podcast, and for you, it's blogging. And for other women, it may be changing careers. Maybe, I remember years ago, a friend of mine who went through it, she's like, "Oh, I'm so grateful that I got cancer." And I was like, you know what? You're never going to hear those words from my lips. It's
no.
I would be really grateful if I got to live the life that I thought I was going to have and that I had worked hard to have. But I understand that was her way of understanding the experience. But it also gave, she became very active in the community, started doing a lot of breast cancer education. So that became an outlet for her, and so I understand her saying that she was grateful, but I was like, I could have managed to get there without, getting a devastating illness too, so,
mm-hmm.
but I say that because I just want to give people permission to have whatever emotional experience they're having. And like you said, I think people think that going through treatment is the brunt of it. And in many ways, I find that's a period of numbness and overwhelm. You're thrown this diagnosis, you have to make these major life-altering decisions with very limited and usually insufficient information. There's a lot of fear. A lot of people just want to put their head in the sand and not think about it and not deal with it. And yet you're not given that luxury. You have to think about it. You have to deal with it. So I think there's a period of numbness and grief that really blocks dealing with some of the other stuff that we've been talking about. And like you said, I think when things get quiet and you're not going to doctor's appointments every day and your mind is not oriented towards what the next treatment is or the next side effect, that's when a lot of that can sometimes catch up with you. And then women can start feeling like, what's wrong with me? I should be happy because I got through this. And, that's not necessarily going to be the feeling that comes initially.
Exactly. And I find that you'll always have people saying things similar to what she said. Oh, I'm grateful I got cancer. Well, you'll have people as the person with cancer from the outside saying like, oh, you got this so that you would make the world a better place. Or the reason that you got cancer is so that you can be more appreciative of life. And women need to understand that when people say those things to you, you are not obligated to entertain those thoughts and think, maybe that is why I got cancer. No, those are those people putting that on you so that they can try to wrap their head around why you got cancer. When people say, oh, you got it so that your purpose is to educate others. Well, I would have liked to have chosen that to be my new role, not have it forced upon me, no matter if I like it or not. It would have been really nice to have a say, in where my life was going. But I do feel like, a lot of people try to make sense of other people in their lives having a devastating illness by kind of creating their own narrative. And it's not our responsibility to make others feel okay. And it's not our responsibility to adjust our thinking to what we think they think, and because sometimes it can get confusing. You have so many people telling you, oh, this is it, or this is it, or, it can just get the waters can get so muddied and really, you're responsible for your own thinking and of why you got cancer. Everyone feels differently about that, but it can just become very overwhelming.
I call it the tyranny of happiness. It's and I do have a very sarcastic sense of humor, but it's actually true. And a lot of times, and I think this is really worth fleshing out a little bit. One of the things that I think is shocking and difficult for a great many women is to find out who their friends are. All of a sudden you go through this and all of a sudden people can just be insensitive, rude, say the stupidest things, say the most hurtful things, and since I know a lot of people in the whole health space, I would add on to all those things that you mentioned about feeling happy, adding on, well, you caused this because you didn't eat the right thing, or you didn't exercise, or you did X, Y, or Z. The fact is that cancer just sucks, and people get cancer. Oh, yeah. And really there's no reasoning that needs to go beyond that. And like I like what you said, you don't have to make those people feel good. And a lot of times they're saying those things to deal with their own inability to show up at the plate and be a decent human being, or to be a good friend. And the fact is I had a friend, she comes from another culture. She's a Native American. And years ago we were talking about this. She's got a degree in sociology and she said, you white girls, she said, you white people, you think about things differently than us. She said, you people have to process everything. You go to a psychologist for everything. You have to process and talk about everything. She said, we view things a little bit differently in our culture. And she said, the first thing we look at, if we were talking about relationships and people not showing up, she said, sometimes you just have to acknowledge that bad behavior is just bad behavior. And it's not acceptable. And there's no amount of processing or going to see a therapist in the world that's going to change that. Sometimes people just act badly, and you can love them, you can not love them, but you just let them be responsible for their own behavior. And I just that has always come back to me years and years later. Particularly.
Oh, I love that.
when we're feeling like we have to take care of other people. I think one of the issues with breast cancer is that it predominantly affects women. Men do get it. I do want people to know men do get breast cancer, but it's predominantly women, and women are caretakers. And I think sometimes when a breast cancer diagnosis comes along, it literally may be the first time in a woman's life that she has to step back and realize that she can't take care of everyone else before she takes care of herself. Physically, she may not be able to take care of everyone else, but women are so accustomed to being in the role of a caretaker and taking care of friends, family, church, community first, that they may have never had the experience of stepping back and saying, no, I can't do that. No, I need to take care of myself. That's not being selfish, but women usually are not trained to do that until they get pushed to the wall sometimes, and their backs to the wall, and they have to do that.
Oh, I completely agree. It's a very, it's an odd position to be put in, especially if you are a mother, if you're used to kind of helping with the household, and especially I know so many women found their lumps when they were breastfeeding. They were told that it was an issue with their breastfeeding, and then it turned out being cancer. And then, yes, having a new baby, or just in general, being used to caring for anybody else in your family, or caring for yourself,
right,
and needing somebody else's help. And it's usually not just one person. It takes a village to care for someone with cancer, including our doctors and our caretakers. It's a lot. And to step back and to allow that to happen. In the blog, I talked a lot about guilt. I had so much guilt and felt so responsible. And I mean, I know that I did not cause my cancer. I know that for a fact. Well, as much as I think I do. And I know that I didn't do it on purpose. And that's what really matters, is I did not bring this upon myself on purpose. But I felt that I was such a burden to others,
right,
which I know that I wasn't, after having many conversations and discussions. But it's hard to not feel that being put in such an unnatural position for yourself that that you're not kind of getting in the way by
right,
being sick.
Right. Right. Yeah, I think that's a very real thing. I think about Elizabeth Edwards. She was in the middle of a presidential campaign, and she knew she had a lump for months and months and months, and it just never took the time to go and have it looked at because she was in such a high-profile, busy life. And it doesn't have to be high-profile political life. It could be that you have kids, that you're just trying to get your kids through school, and you're trying to run a household and work and be part of your church and community. Women take on so much caretaking that's really under acknowledged in terms of what do you do when you need to stop and say, I need some help too. And I think one of the things is that I work with a lot of my clients on is how to ask for help. It doesn't have to be that someone has to come over and process your cancer diagnosis with you. It can be something like picking up your kids from school. It's not just a casserole experience of dropping something off, but it can be really asking people for very legitimate forms of help so that all of that burden doesn't fall on you. And I do think it's incredibly difficult to do that without a sense of guilt.
Definitely.
So I really want to make sure that we get time to talk about your blog, because I was reading some of your blog and it was just really great. But talk to me about your blog and where that came from. And it sounds like it started as a personal healing tool, and it sounds like it's become something much bigger.
Yes. So I've always loved to write. And I wanted a way, it was just supposed to start out as a very casual way for me to keep friends and family updated. I didn't want to have to get on Facebook and write separate posts every time I had an update, because I thought it would get buried, or thought, well, there's probably people who aren't really interested in this. And so I wanted to make kind of a separate place to just talk about this. And what it turned into was almost a diary where I just found myself being pretty vulnerable, but also I was able to laugh about things. And I know everyone deals with trauma and with pain different ways, but I really discovered that humor is something that I used quite a bit to make myself feel better. It was being able to laugh about things, didn't make them any less serious and any less scary, but it was easier to talk about them, and a lot of people say, well, you got to laugh so you don't cry. And it was kind of something like that in a sense. My husband would pop on from time to time and write blogs if I wasn't feeling well, or if I couldn't write for whatever reason that week. And so it's something that we kind of got to do together, which was very healing. But I found that more people started reading it than I expected. It was getting shared quite a bit. And I kind of went back and forth from more personal, talking about my own experiences, to other ones would be more generic or more general to the population of what not to say to someone with cancer and stuff like that. Now, towards the end of the road for me, as far as treatment, which I think my last blog post, one of the last ones, it was when I finally had the surgery, there was a long hiatus there. And that's when I didn't know it at the time, but the PTSD had started to kind of kick in and rev up, because I found that I couldn't write. And it was almost like that loss of purpose thing. I thought, well, if I'm not writing about cancer, what am I writing about? And I have found that since then, I've kind of taken more a role of educator and advocacy. And so I'm not writing as the person with cancer or as the patient, but I'm able to kind of write about it from the other side, which has been really healing. And so, like you said earlier, having a creative outlet is so important. And I just found that once this started, it just kind of sparked a lot of opportunities and opened up some doors that have been just so great in terms of me having the platform to speak out and to educate, which has been extremely rewarding.
I really wanted to touch on something that you said there, which I have found in my own personal journey and the journey for me and my husband, which is you saying that your husband became part of that. And I really think that doing something like that, where you do a project together, can be incredibly healing. You know, men and women express emotions differently. And, you know, when I was going through treatment, I would stop and I'd ask my husband, I mean, I could see the stress and the worry and see what was happening. And I'd ask him, you know, how are you doing? And he'd say, oh, it's not about me, it's about you. And he did everything he could to support me. And I kept saying, no, it's about us. But men don't tend to think that way. They're not as, you know, emotionally oriented as women sometimes. And that became at one point actually became an issue that we had to address, because the anxiety and the fear and the frustration all built up to like a breaking point. But I think one of the ways that doing a project like you talked about is as a way to recreate intimacy. And that's one of the things that you lose. I mean, let's face it, you're going through a disfiguring experience, you're going through surgery, you're going through pain. I don't know anybody that it hasn't affected their sex life, usually in not a very positive way, and really struggling with body image and sexuality and intimacy. And yet you're with somebody who loves you and cares about you, but feels helpless to know what to do to help you sometimes, going through PTSD, going through this anxiety, going through the depression. That can be really difficult for your loved ones to see and not know how to help you. And so I love the fact that you both found something that you could both be part of. And I think that that can create a way of communicating and rebuilding connection with each other.
Yes. I mean, it was very, very helpful. Similar to what you said, my husband as well tends to be, he's more introverted. Not a big feelings guy, at least not expressing them with his words. And something that meant the world to me that he did was, while I was actually under for my double mastectomy and reconstruction, it was about, I think, a 12 or 14-hour surgery. He wrote me a letter and he published it on the blog.
Wow.
And it was the first time that he had put a lot of those things into words. I mean, and like you said, ours as well kind of came to a head, because I remember one particularly menopause-fueled breakdown, I remember asking him, do you even care? I can't even tell if you care. And of course I knew that he cared. Of course I knew that. But he didn't show his emotions the way that I did. I would cry at the drop of a hat, and he was there as kind of this pillar to hold me together. And so he wrote that.
Let me just intersperse, for men is a huge part of their identity. That is a huge part of how they feel like they're helping you, is to be that pillar of strength.
Yes, definitely. I mean, I remember seeing him. He cried one time that I can remember. It was I got the call really quick. I got the call when I was up at a conference in Dallas for work by myself. He drove up. We drove back to Waco. That night we were laughing about it. And it was just kind of this, I cannot believe I have cancer. This is crazy. This is nuts. And we're kind of joking. And the next morning, I accidentally woke him up because I was crying so hard I was shaking the bed. And he rolled over and he held me and he cried and I cried. And he said to me, "This isn't funny anymore." And that's when it really hit us. And then the second time that he cried was the day I found out that I had no evidence of disease. And I got some cupcakes and I brought him home on our lunch break because we lived so close to work. Brought him home on our lunch break and he opened the box and I had written, "Guess what? We're cancer free." And he turned around and he grabbed me and we both just bawled in the middle of the kitchen.
Oh.
And so those two times I think are just so symbolic of the fact that he cared the whole time, but really at the beginning it hit him and at the end it was closure for him. And that didn't mean that just because right there in the middle, he wasn't feeling anything. He was just holding it all together for me, which might even be harder, having to hold your breath and keep your composure rather than really just kind of let it all out, Right. And so I think sometimes we misinterpret someone not showing emotion as being cold when really, they can be being brave and strong and caring, because he probably knew as soon as I saw him break, I was going to break.
Right. Right. Absolutely. Absolutely. And, for men, showing up and being that pillar of strength is a huge part of how they're kind of trained and I'm not sure I get the word right, but culturalized. That's what men are taught to be. And some of that may be changing, but it's still, they love you and that is one way of taking care of you. And I used to sit there and think, like when I'd go in for a surgery, I'd be under anesthesia for 8 hours. But my husband was the one sitting in the waiting room wringing his hands for those 8 hours. He didn't get that opportunity to be, oblivious to what was going on. He was there every single minute, worrying every single minute.
Exactly.
Well, you really, I love the reality that you bring to this. And I'd love to have you back because I'd really love to even just talk about the experience of going through this at such a young age, because there are so many things that come out of that. But with what we've touched on today in terms of the post-traumatic stress and the anxiety and the depression, I know that this is something that you do professionally, and it's certainly a personal passion of yours, but we've talked a lot about it, but is there anything you want to talk about or any recommendations that you could make if somebody is struggling that we haven't already covered in our conversation?
Definitely. I'd really like to touch on just the type of psychotherapy that I found has been proven to work for post-traumatic stress disorder, but it was the type of psychotherapy that I went through that really changed everything for me. And I myself am not certified. It takes a special certification and an amount of hours and supervision for this. But it's called EMDR. EMDR, it stands for eye movement desensitization and reprocessing. So it's a bit of a mouthful. And basically what this is you're going to sit there and make sure that your therapist or your practitioner, is certified and knows what they're doing. Now, basically, you're going to be asked to recall specific images. I was asked to recall a specific image that really kind of triggered me the most. And for me, that was personally the very moment and what I saw the moment I heard on the words, "I'm sorry, but you have cancer." And I vividly remember that moment. And when I used to reminisce, it would immediately make me cry. It would immediately trigger a panic attack. It was something that really affected me. So you're going to think about that. And while that's happening, while you're recalling that image, something's going to be generating one type of bilateral sensory input. So this can look different for different practitioners. It can be, I had on headphones, there was a beep that would go from every other ear. I also had paddles in my hand and they would take turns vibrating on and off. So basically what it's going to do, and of course, again, I'm not certified in this, But what it's going to do is it's going to trigger different sides of your brain while you're doing this, and it's going to reprocess those memories. Now, within 3 sessions of doing this, I could think about this image and I would not cry. And so it's a different way to go about other than talk therapy. And it's something that's proven for PTSD. And it's something that if you're serious and you're really struggling with the signs and the symptoms of PTSD, EMDR can be a game changer. And so I would really urge women to seek out that therapy. There are others that are available to you, but that's the one that I really, really believe in and I found really worked for me. And something that, I think it's coming about and it's getting more, I guess, coverage, and it's being talked about a little more in the medical area of PTSD.
This is something. It's really interesting, and I hope that I can explain this clearly. But sometimes I get really frustrated when women are just told, well, go see a therapist or go on medication. Those are the 2 biggest things, therapy and medication. Mm-hmm. And it's not that those things are wrong. In all cases, in many cases, I don't think they're helpful. But the kind of the problem that I see with that is, it's assuming that if you're having a hard time, that there's something wrong with you psychologically. So, that's what therapy is, is there's something wrong with you. And there is nothing wrong with you if you're having feelings and a reaction to the fact that you've been diagnosed with breast cancer and you're going through treatment. It's not a psychopathology. It's a reaction to life events. So one thing that I really like to do is normalize that. For one thing, if you're not upset when you've been diagnosed with cancer, I think that would probably be unheard of, or very rare, so it's not a psychopathology. And I love the fact that you're talking about EMDR. I've gone through it myself. As I said, I have personally gone through post-traumatic stress. And the thing that EMDR does is it's not processing the thing. Sometimes talking about it is not going to change anything. It's not going to change your emotional reaction. And EMDR is very much just cutting to breaking. It's I thought you were going to say cognitive behavioral therapy because, it's also another modality that kind of breaks that habitual thought process that we can get into, that can kind of keep us in the same place. And that's what I like about EMDR. And I think EMDR and I want to make sure that for people who don't know what that is, it's eye movement desensitization and reprocessing, but it's not talk therapy. It's actually an intervention. And what I like about it is that it's not assuming that there's anything wrong with you if you're having difficulty. It's just dealing with the fact that you're having difficulty and helping you get to a better place.
Exactly. And and like you said, normalization, there is nothing wrong with being on medication. If you are comfortable with being on medication, it's something that you've talked about with your doctor. I will say though, I personally am glad that I decided to seek EMDR therapy prior to seeking a psychiatrist because I was able to, now I do have a prescription for emergencies, which I happen to take. I have to get rescanned every 6 months, and probably the week before and the week after while I'm waiting for results. I need some extra help then. But as far as just, everyday medication, I was able to, avoid that with starting with this kind of therapy. And if it had not worked for me, or if I needed backup, I would not have had a problem taking medication. But I think that a lot of people want to immediately jump. If you're going to go to your PCP or your primary care physician and say, I'm feeling this way this many days out of the week, and I'm not getting out of bed, and I'm not, if you don't have a doctor that works holistically and that is going to really keep in mind everything you've been through, they may be quick to write you a prescription for psychotropic medication, when in reality, if it's something that you can work through because you've gone through a traumatic event, you can avoid having to be on, medications. Because I know some women, especially those that have had hormone cancers, mine is triple negative, they're on long-term medications, hormone medications. And I know that those can sometimes interact with psychotropic medications. And so, it's not that I wish doctors wouldn't prescribe them. I just wish that it wasn't their first go-to.
Right. Right. And that's a really good point. I mean, there's so many drug interactions, and, I'll just say, from my perspective that the most common antidepressants that are prescribed originally were meant to address short-term situations of depression. They were never meant for someone to be on them for years. And yet that's what happens. I've seen clients who have been on an antidepressant for like 10 years. And then, I ask them, well, is it helping? And probably to a person, it's like, no. There comes a point where they don't help. They can help in the short term, but as a long-term plan, they're not always helpful. And then the problem is they can be very tricky to get off of. You never want to go cold turkey if you've been on one of these medications for a long time. So you can start having symptoms when you try to come off of it. But like you said, sometimes, in my experience, sometimes the most effective use of those medications is for short-term interventions, but then backing it up with something that's going to help you kind of address the underlying difficulty that you're having without relying on the medication to do that.
Exactly. And I think that just kind of piggybacking off of that, like you said, having it as a backup, I think is a wonderful idea. And also using it in conjunction with some coping mechanisms. Just because you're going to go to EMDR or whatever kind of therapy you're attending doesn't mean that there aren't times. For some reason, after I got cancer, all of a sudden I would start getting very panicky before I would get on flights, and I had never had an issue with traveling. And so, I would, in the airport before getting on the plane, would have to utilize those coping skills and do my deep breathing and my self-talk. And, that is in conjunction with medication and me going to regular therapy. And so, there's no one size fits all, but there's also no, this one thing is going to be the magic pill or the magic cure-all for everything. Sometimes, having a backup or doing multiple things is what's really going to get you to where you need to be.
That's so really the approach I take in the groups that I run. I run online and in-person groups, and it's really to give a number of tools that you can use in these different situations. And just in terms of self-care, it's not even that you have to be having a problem, but just really learning to navigate this, which, as I said, a lot of people don't do that until they're in a situation where they have to. But having some of these tools can keep you from having to use medication only as the response. I studied a modality, it's called mind-body skills, and it's using breathing and meditation and visualization. And that's what I like to teach my clients, because we can all use that. You don't have to be in the midst of a diagnosis or recovery to use it, but most people haven't heard of it or don't know how to do that. And I really like the idea of people having options so that they can utilize that. And like you, I had never had a panic attack until I was, it was after my first treatment, and I was going through PTSD, and I was out at a coffee shop and I had a panic attack. I had no idea what it was. I started hyperventilating. The room got really dizzy. I had no idea. It was like, I got home, I was scared. And then when I could sit down and think about it, it's like, oh my God, that's a panic attack, but I had never had one. It was just like everything was different, and I didn't at that time have the knowledge or the ability to know what to do at that point in time. So just in closing, I just wanted to, you've talked about a couple of things, but I really want to emphasize that post-traumatic stress is a very normal reaction to a life-threatening event, which breast cancer and cancer is a life-threatening event. I'm just wondering if you could take a few minutes and really talk about what some of the key symptoms are, so that someone may not be aware of the fact that they're having post-traumatic stress reactions. What are some of the more common things that you see?
So the more common things, we're going to have trouble sleeping, whether this is insomnia, breaks in sleeping as far as you being woken up from nightmares, from intrusive thoughts, a lot of anxiety. Like I mentioned before, one of the things that is actually pretty common, but people just don't put two and two together, is being spooked all the time. Having your anxiety so high, you may not realize that you're on edge constantly, but when someone honks your horn, it makes you jump. The dog starts barking, somebody walks into the room and it makes you jump. Anything like that, that's unusual, that you didn't feel that way before. There's going to be, signs of depression, signs of other generalized anxiety disorder that are going to pop up. A lot of this can also be accompanied with survivor's guilt. That's another thing that ties into PTSD and just having cancer in general. And that is with you're having questions of why me? Why did I survive? Why did it not kill me? But it hurt this other person and they're not going to make it. But I'm still here. I don't feel that I'm worthy of being alive, or I don't feel like I've earned it. Kind of in your head trying to make sense of everything and really being left with a lot of guilt. The survivor's guilt can play a role into that. And really all of these things, PTSD is one of these things that it can continue to just get worse. Right. I mean, at least for me, my symptoms really they would rev up on certain things that triggered me, such as having scans or cancer being brought up or seeing a commercial or smelling my oncologist's office. I mean, I can just describe it as the smell of chemo, and I can picture it and smell it in a heartbeat. Anything like that that's going to trigger a panic attack, high blood pressure. It got to the point where every time I entered my doctor's office, my blood pressure would skyrocket. And so they sent me to a cardiologist. And what it was situational anxiety. Right. That PTSD was manifesting itself in things that I wasn't even aware of that were triggering me. So walking into my doctor's office, I think I'm fine. My body is not fine. My lizard brain is firing off and it's fight or flight, but I'm still sitting there and my body is trying to tell my brain, what are you doing? Get out of here. You are not safe here. And even though your brain and your mind, when you have PTSD, are sometimes not connected, that's what we're trying to work is to reconnect those two things. And to have your brain be able to tell your body, no, we are okay. Let's breathe. Let's calm down. I know that this happened one time, but it doesn't mean it's going to happen again. Because really your body at its core is just trying to survive. Right. It is trying to avoid going through what it has once gone through. And your brain may be a little smarter than that, but when they're not connected and you've gone through that traumatic event, you have two pieces of your body that are really trying to fight each other. And so really PTSD treatment is really just trying to get your whole body on the same page.
And I will add to that, just from my own experience, my way of it coming out was on the anxiety spectrum, where I just became hypervigilant, especially at night. I lived alone, and every noise I heard outside of my apartment, I was just like, oh my God, somebody's trying to break in. And it was this hypervigilance that was not reasonable to the situation. It was actually, watching a TV show where people were talking about PTSD and they're like, are you hypervigilant and waking up 25 times a night, looking out the window, thinking people are breaking in? And I'm like, how do they know my life? But that's, but these things, I just want to really emphasize they're normal. They are normal reactions. And the other thing that can happen, and I think I've heard women talk about this, particularly when it comes to scanning and testing, is that dissociation, where you feel like you're floating and your mind is not really connected to your body. That's usually a very entrenched coping pattern that people can get into when they're experiencing this, where it's like, I don't remember what happened, or just don't feel connected. And as we've talked about, all of those things are normal. It does not mean there's anything wrong with you, but it does mean that you need to find really skilled and knowledgeable people to help you get to a different place. And not every therapist, not every doctor, not every friend or family member is going to understand what it is or how to help you. But if you can find someone who is knowledgeable in these areas, then they can help you understand it in a way that doesn't make you feel like you're going crazy.
Exactly. And like you said, have a friend or somebody that's not going to make you feel bad about this. Just know that when you go through this process, you will have different friends, not all different friends, but there will be friends who just disappear and then they'll pop right back up after you're done with treatment. it's the weirdest thing. And you'll also meet people that you're going to be closer with, but just know that, those people who are really there through the long haul, if they really support you, they're going to walk beside you through this aftermath, because it's easy to show up for chemo and to bring someone meals. But if they're going to sit there and listen to you express that you're sad, or that you're needing help, or that you're going through this treatment, the people that are going to sit there in the silence and through the hard stuff with you after the cancer treatment is gone, that's when I think those are the people that are really going to stick around. And those are the people that you need to hold on to, because I think there's a little bit of some people, as terrible as it sounds, it's almost sexy to have that friend with cancer. Oh, I'm going to bring them this, and I'm going to bring them this, and I'm going to take care of them, and they want to care for you. But when it's over, you need the friends that are going to sit there when it really gets rough and it's not as visible on the outside. They can't bring you a meal because you're having panic attacks. I mean, they just need to sit through the hard stuff with you.
I call it the casserole experience. Those friends who show up with a casserole and feel like they've done something,
oh, goodness.
And then they disappear.
And it's so funny. They also, and a lot of people, some people disappear, and I understand the people that disappear think, well, I didn't have anything to say and I don't know what to say. And, when I'm talking to people who have friends who have cancer, or family members who have cancer, I just think of my best friend on the phone. She lives out of state. She told me one time, I don't know what to say to make you feel better, but just know that I'm so sorry you're hurting. And that was in itself.
That's all you need.
Absolutely enough. That's all you need. One of my favorite quotes is, it's be messy and complicated and afraid and show up anyway. And it's about showing up. It's not about what you look like or what you have to say or what you don't have to say. It's about showing up.
One of my friends that I lost, I think the first cancer experience, he just couldn't deal, and he just couldn't show up, as a real person. He just couldn't show up at all. And I remember months later in the one conversation I had, it was like, I didn't need you to help me fight the cancer. I just needed you to show up with a funny movie on a Saturday night. And we could just, just do anything besides talk about cancer. Sometimes it's like you don't have to be there for the chemo treatment, and you don't have to be there necessarily for the hard times, but show up with a goofy movie. My favorite is Young Frankenstein. That can get me out of any depressed mood instantly. It's like, just show up with Young Frankenstein. That's what we used to do before I was a cancer patient. But I get it that people are uncomfortable. There are those people who are uncomfortable, like your friend, who really want to be there and don't know what to do. And then there are some people who just aren't going to be there. And I think that going through this, you get really clear. But once again, it's not your fault if someone else is not able to deal with your illness. It's just them, and
exactly.
No reason to be guilty about that. So we've talked. This has been such a great conversation. I love talking to you. But can you give people information on how to find your blog or how to connect with you if they have any questions or just want to connect with you?
Definitely. I mean, I'm always open to conversation and questions. And so the blog is www.netflixandchemo.com. Netflix, like the streaming service, and chemo, CHEMO.com. My Instagram name is Maegan Mohlner. Maegan is spelled a little funky. It's Maegan Mohlner, Molnar. And then my email is meganmohlner@gmail.com.
Great. And I will have this in show notes, which people can connect with on my website, and I'll have that information at the end. But I just really want to thank you so much. This has just been really great. There's just so much more we can talk about, so I very well might invite you back. But I really appreciate you taking time to join us today.
Oh, well, thank you so much. I know we bounced around quite a bit, but I love talking with you, and I'd love to come back.
That would be great. So to our listeners, thank you for joining us this week. And you can certainly access show notes at my website, which is www.mindbodynutritionrn.com. And really, if you're struggling with any of this, or if you have questions about integrative health or how to really take control of your own recovery process, I really invite you to reach out to me at radicalhealthrn@gmail.com, or reach out to Maegan. And if you're in a place where you're really struggling with the things that we talked about, just reach out. Oftentimes nurse navigators, which are resources in many practices, will have resources for you. But if you really feel like you're struggling, just reach out to a support group, to someone who understands, but just don't feel like you have to be alone and that you're going crazy and there's no one out there for you, because there's a lot of us who really do understand what this process is like and really want to be there as a resource. So thank you for joining us, and until next week, take care.
Thank you for that information, Maegan, and I will certainly include that in the show notes. For our listeners, you can access show notes and a recording of today's podcast through my website, which is www.boobsaren'tworthdyingfor.com. That will take you to my website. You can look under the podcast section and find recordings of today's show as well as previous episodes. You can also find information about my coaching programs and schedule a free consultation to talk about integrative health and how I might support you in your recovery and developing an integrative recovery plan. You can also arrange for that by contacting me through email at radicalhealthrn@gmail.com. Thank you for joining us today, and until next week, take care. I really do invite you to reach out with any questions, comments, or if you would like to schedule a time to talk. Thanks so much, and I'll see you next week.
Thanks for listening. If you have questions or feedback, you can reach Deborah at radicalhealthrn@gmail.com or her website, www.mindbodynutritionrn.com. You can also find us on Facebook under Boobs Aren't Worth Dying For. For future episodes, subscribe on iTunes, where you can also leave positive reviews. Until next time.